Hello everyone, Heidi here from the Nest Kids CPR and Allergy, and today's video or podcast, if you're listening on our podcast, Feather Your Nest, is going to be all about food challenges. And now food challenges might be something that you've heard of if your child has an allergy to a food, and there's something that should always be done under hospital guidance. Sometimes your doctor will send you home to do a food challenge at home. Normally this is called home introduction or parent-led introduction, but a lot of food challenges are also facilitated in hospital. Obviously during COVID, a lot of, especially in Australia, a lot of food challenges were actually just completely cancelled. It was deemed a non-essential service, so it was cancelled, but we're back up and running now, and I don't see us being cancelled again because of the way the trajectory is going. So we'll talk today about food challenges, you know, what constitutes a food challenge, when do you get referred for a food challenge, what happens, and about the outcome. Because it's very important when you have a food challenge that you're willing to keep that food in the child's diet. So what we tend to see, especially with older children, like towards teenage years, is if they come for a food challenge, they come and they'll eat the food for us for the day, but then they go home and they won't eat the food for the parents after that. And it's a wasted appointment, because if you don't keep that food in your diet, we know that you can become allergic again. So it's really, really important that we keep that food in the diet after we've introduced it. So an in-hospital food challenge is referred by your doctor. So usually it's a pediatric immunologist, and they're the only ones that really have the admitting capability to refer to a food challenge in a hospital. Otherwise, some challenges have to be done in private rooms. And basically, the doctor will refer you for a food challenge if they believe that your child is ready to have a challenge. And again, this really needs to be a pediatric immunologist or a pediatrician with a special interest in allergy at the very least. Someone who's capable of doing skin prick testing in their rooms or in their hospital, because you need this information to be able to know whether a child is ready for a food challenge or not. So they will refer you for a food challenge, and you'll go to your local hospital if they do them, or you might have to go a bit further afield. I know in Sydney we get children from all over, including Canberra. So what happens is any food, a child can be allergic to any food. So we get food challenges to all sorts. We've had snail, papaya, all sorts of things. Obviously, a vast majority of them are the top 9, the nuts, the egg, the milk, the wheat, and those kind of things. And that would constitute at least 90% of our challenges are from those foods in the top 9. But, any food you can be allergic to, so you could have a challenge too. And you come in on the day, and on the day that when you're given the appointment, so you'll come in and we'll have to make sure, first of all, that your child is well. We don't want to be doing a food challenge to a child who has an existing cough or a wheezy chest, or any kind of illness that could mask the symptoms of an allergic reaction. Or if they're already at a low ebb and they're not well, we maybe shouldn't be doing a challenge just in case. Because remember, this is an immune system response, an allergic reaction. So we need to make sure that their immune system is in tip-top condition, basically, before you come. They shouldn't have had any antihistamines before they came to the food challenge, because obviously we don't want to dampen down any reactions. We need to see in real time what's going on. But things like inhalers and steroid creams are absolutely fine, and nasal sprays, they're fine. We just don't want them to have an oral antihistamine like the syrup or the tablets before they come. It's very important actually that children still have their inhalers, because we don't want them to be wheezing when we come, because we won't do a food challenge on a child that's wheezy, because obviously a wheeze is a sign of anaphylaxis, and we don't want to be confused about what's what. So once the child has been checked by the nurse and consented for a food challenge, we will also do some observations. We want to know what the blood pressure is, because obviously a sign of anaphylaxis is a drop in the blood pressure. So we want to know what the blood pressure is before we start the challenge. And we also do oxygen saturations, respiratory rate, heart rate, We don't always do a temperature because it's just not really relevant to anaphylaxis. So we don't always do a temperature, but we just do a set of obs and make sure that the child is well. We'll ask about existing patches of eczema. We'll ask about any recent history of exposure, because they might say, oh yeah, actually, he's been eating macadamia nut cornettos for the last week and been absolutely fine, and he's in for a macadamia challenge. So these things happen. Or someone's been eating something with egg in it and hasn't realised, because it's an ingredient, and come for an egg challenge, So we ask those kind of questions, that has there been any recent exposure, and, is it necessary to go through a food challenge? So once we've gone through all that and we've made sure it's safe to go ahead, we then actually commence the food challenge. So with nuts, we give them over 5 separate doses. So we start small and then grade up slowly to a larger dose at the end. And we wait 20 minutes between each dose. With egg, we give 6 separate doses. Basically, by the end of it, they would have had like a whole egg. And there is a grey area with these food challenges. If the child is quite young and they're not going to manage a whole egg, because sometimes we mix that egg with something if the parents think that it will go down better, or the nut, and they're actually quite full and they don't always want to eat like a whole baked muffin or a whole plate of scrambled egg over the morning, because they're often snacking in between as well. So sometimes they may only manage maybe half of the challenge food. And depending on the doctor that's on that day, they might say, do you know what, that's okay, because they've shown no reaction to that food. So, they've only got a small appetite. Let's just go with that half and then just grade up slowly at home. So that might be some of the advice that we give on the day of a food challenge. But we always send people home with very clear instructions, because we always need to make sure it's like safety first. So with wheat, we can use like flour into like a drink, or we can use some like whole wheat pasta and things like that. But it has to be measured out, and it all follows protocols written out by ASCIA that give us food challenge protocols. So it's all very measured, and we know exactly what we're giving and why we're giving it. So it's not just giving a little bit here and there. We know about the measurements because we've decided to do this in a controlled environment in hospitals. So we have to follow the protocols. So what we do is we wait 20 minutes between each dose, and obviously that gives us time to look for a reaction. Most allergic reactions happen within sort of 5, 10, 15 minutes. Obviously not all of them, because allergy is completely unpredictable and we don't know if there might be a late reaction, but a lot of the time, most of the time, it happens before that 20-minute period, which is why we wait 20 minutes. We've also got that 20-minute period because if you add up those 20 minutes between doses, that takes us into a couple of hours. And we need to know that they've had that full amount within a specific time period, so that we know all that food's in the tummy at the same time. So that gives us an idea that they really are okay with it. It's not like we've spread a whole egg out over a whole day where their immune system is only getting a little bit of exposure every couple of hours. That really doesn't tell us. It's kind of, there'll be a bit passing through and then another bit coming in. So it's not really telling us that there is a whole, it's normally when you eat a meal, the whole meal is sort of in the tummy at the same time, if you like. So that's why we need it within that period of time, and we don't just do it over a longer period of time. We're looking for, obviously, signs of reaction all the way through. The reason why we need skilled nurses to do these challenges is because we need to be able to know the difference between what's okay to push on and what's not okay to push on. And that's just very individual to each child, very individual to each food and each challenge. There is no, with this symptom you would push on and with this symptom you wouldn't. It very much depends on the child. But there is a bit of a grace period where we can say, let's just hold off. Let's not give the next one for another 10 minutes, or let's, have a drink and see if it washes away that funny feeling, or, it's very much, that's why you need skilled people to do these challenges and to assess whether we continue or sometimes stop a challenge if a child is not coping with it, or if they have an allergic reaction. We obviously have, there would be all the emergency equipment there in case of an emergency. You've got to remember that food challenge nurses and allergy nurses are very, well trained in dealing with an allergic reaction. We know what anaphylaxis looks like. We know how to treat it. We know that adrenaline is the only way to treat an allergic reaction that turns into anaphylaxis. And obviously we'll have antihistamine there for the mild to moderate symptoms as well. But we also have all our OBS equipment in the hospital as well to be able to check blood pressures and just check that everything's monitoring okay. The beauty of doing it in the hospital is if it gets that bit further where we're needing to give more than a couple of doses of adrenaline to a child that's having anaphylaxis, then, you know, we have in a hospital, we have a system called an emergency response system. Every hospital in Australia will have it. And that sort of escalates it to the next level. Most children don't get to that, but obviously we have had scenarios where that's happened. But, you know, there's always a system in place, which is why we do a lot of these challenges in hospital. So if your child passes the food challenge, then they will go home eating that food. And it is very, very important that they continue to eat the food when they get home. We give specific instructions on continuing for a few days, and then after the few days, making sure that they keep that food in their diet at least weekly or twice weekly, because we know that if you have had a previous sensitivity or reaction to a food, that if you stop having it for a period of time, you can end up becoming re-allergic again. So we need to make sure that when you're having this challenge that you are going to continue to eat this food. So what we recommend is, you know, if it's a nut, we recommend that, you know, as we knock off the nuts one by one, depending on how many your child has, we just say that the nuts that your child is safe with, blend them all up together into a pot in the fridge, and you can just pop the, you know, a spoonful of those nuts on their ice cream or yogurt once or twice a week, to make sure that they're exposed to it, so you're not having to think about the nuts as individuals. You know, making sure that eggs are a bit easier. You know, you can incorporate egg into a diet at least weekly. That's usually not a problem, and milk the same. You know, you can even put your milk in your scrambled eggs if they're fine with the both of them. It's pretty, yeah, I think that's the easiest way to incorporate the nuts. With things like fish, you know, you have to just worry about really what fish, if you're coming for a challenge, what fish would your family eat? You know, talk to your healthcare provider about, you know, the person that's doing the challenge, and make sure that you're not being challenged to a fish that actually you don't know even where to source. You don't know if your family's going to eat it. So go for the things that your family eats regularly so it can become just a normal part of the diet. So I hope this is helpful today. So that's a bit about food challenge. Remember that we have lots and lots of resources for you here at the Nest, lots of free resources. We've got our virtual first aid kit, which is at the bottom of every page on our website, and it's also pinned at the top of all of our social media and Instagram. It's through the link in our bio. You'll find the virtual first aid kit, which is like a PDF document which has all about choking, CPR, and all kind of other first aid situations with a child. We also have our 30 days to crush food allergy fear program. So this is a 30-day allergy support program that parents can come in and just get some intensive education and support on their child's allergy, just to really help with all things, even the mental health side of living with a childhood food allergy. We've got a membership portal full of information for you guys, which we drip feed to you over the 30 days. You can ask questions inside the group as much as you like, and it's answered by allergy nurse professionals. So that's our 30-day allergy support program. We also have our classes, so always keep an eye on our classes page, because we have in-person classes, online classes. We do them in Canberra and here in Sydney, so take a look at our classes too. And in the meantime, take care, and we will speak to you very soon. Bye bye.